Hi, this is Kenny, co-founder of Aiskyra. Today we're going to quickly overview a tool to help you become more compliant with the regulations related to pharmacist extension of prescriptions. So if we go to the Ontario College of Pharmacists website, there are some information about what kind of documentation that you need. Under Section 7, Document and Notify, you have to include certain things in the patient record, including the rationale to extend a prescription. If you're extending metformin, for example, you can't just say, I'm extending it because the doctor's away, or I'm extending it because they've been on it for the last 6 years. We'd also need to include any other lab or tests. For example, if it's metformin, maybe they checked their blood sugar that morning. You also need to include follow-up and monitoring. Similarly, if you are a pharmacist and you're undergoing a practice assessment, there are some criteria that you need to follow to make sure that you are appropriately assessing the patient. Specifically in this section here, there's some guidance statements. So here's how our AI medication expert can help you produce these clinical notes that go into a patient's record. Now, this is not OCP endorsed. This is just a tool that we've made to make your documentation process faster and easier. So on our platform, there's a button above the chat bar where it says extension assessment. You click that and a box will pop up. All you do is enter the name of the medication. In this case, let's say it's metformin. Click submit. And our AI will pre-populate a query for you at the bottom. And all you do is click send. So what we're asking the AI to do is to create 3 sentences. 1 sentence on why it's important to not miss this type of medication, which is one of the reasons why you're extending it. 1 sentence is the common side effects, which you can use to counsel the patient. And the last sentence is another counseling point in terms of patient self-monitoring. So here's what the AI has generated. 1 sentence about why you should not miss metformin, basically due to blood sugar management and the risk of diabetes complications. Common side effects that you can use to counsel the patient: nausea, diarrhea, stomach pain. And then patient self-monitoring parameters, basically just encouraging the patient to continue monitoring the blood sugar levels. And there's also reference, so this is actually the metformin's Health Canada approved product monograph. So this tool is available today for you to use on the AI Medication Expert at www.aiskyra.com.